Everyone, welcome to Mtandao Varsity School of Soft Skills. My name is Kevin Anyango, the founder of Mtandao Varsity School of Soft Skills podcast. The platform talks about those behaviors or characteristics that employers are looking for or open opportunities. Today, I am not alone. Today, I am with one and only Obi. Obi, welcome to the show.
Thank you, Kevin. Very glad to be here.
MZ
I remember I was either... Yes, thank you.
Carry on.
Yes, I was saying, I think I was perhaps among the first people to be hosted by you, and it was quite an honor. I remember, I think May of 2020, so you've kept on doing this, and really impressive. Congratulations to you for having kept the platform that long, the podcast, and glad to be back.
Obi, we're in the church, but that is true. Yes, you started it for me actually. That was the beginning of the pandemic when COVID was just starting causing disruptions, and I think you were in South Sudan at that time, wasn't it?
Indeed, I was in Juba, South Sudan, and I still remember challenges with the network there,
yes.
Internet connectivity, but nevertheless, we did the show. Thank you.
Indeed, and here we are. I'll go straight to the point. I mean, so being in South Sudan and now in Kenya, COVID disruption is still there, man. It's nothing much has changed. What do you think?
Well, thank you for indeed. That's a really relevant way to start the show. Yes, I was in South Sudan then. It was still, it was actually at the onset of COVID. If you remember correctly, May of 2020, I think COVID had started getting into the continent around March there. I remember even in Kenya, it was around March when the President Kenyatta, closed the borders, and so really challenging. Yes, the pandemic has still continued to be with us. Obviously causing a lot of challenges for young people, people having to work from home and all that. But I believe that there's a bit of change in the sense that perhaps the anxiety that was at the beginning of the pandemic has kind of subsided. So we are not yet out of the pandemic, if I may say so. But I think we are beginning to see that, many people are beginning to now be able to know how to perhaps continue life even in the midst of the pandemic. Thank you.
Well, talking about anxiety, so we'll put that as part of the mental health challenges, isn't it?
Of course, a big one for that matter. And rightly so. I mean, I remember myself being stuck in my room in Juba, South Sudan. Couldn't go out because everything was shut down. There was a lot of anxiety as we watched news. And I'm talking about CNN, Al Jazeera, all those world broadcasters, just kind of showing us how the pandemic was ravaging, Europe and North America. So the anxiety was quite well founded, and so that continued, and I think that has been a significant challenge for many people during this time of COVID.
Well, look, you and I, we are very lucky that even during the pandemic, we kept our jobs. But there are people that lost their jobs, and in particular, in this particular talk, I want us to concentrate on those that were looking for opportunities, and COVID brought disruption, so they need to know whether to carry on or how to look for these opportunities really. So perhaps what I'm trying to ask you, Obi, is how effective it is when someone's looking for opportunities and these mental health challenges that you don't know whether to disclose it to prospective employers. How do they deal with them?
Well, yes, definitely. First of all, I really resonate with what you mentioned. We are very fortunate, you and I, and perhaps other people, but not very many, that were not adversely affected by economically by the pandemic. But we know, I know friends, I know family members who were told either to go home and be on half pay,
Yes.
and then eventually perhaps those jobs were they couldn't hold, so many lost jobs. There are those who continue to be on half pay,
yes.
and all that. So yes, it's been a very, very challenging time for the globe, really, for many people. And I can only imagine the hesitation, maybe, or even anxiety for young people who many of your viewership are young people, as they think about even navigating the job market right now. I mean, we are talking about many people who are downsized,
yes.
let go. So what's the hope for me as a young person, maybe coming out of college, or maybe didn't even have the opportunity to go to college, but was hoping that they can get a job? Rightly mentioned, a lot of maybe hesitancy, anxiety, maybe even just helplessness, a feeling of helplessness for those job seekers in this season of COVID.
Can they control that? Can you? How do you work around anxiety as an expert yourself? I mean, it is actually. Let me ask you something. How do you define anxiety in a normal man's language?
in a layman's term, anxiety is I mean, it's a feeling of not being in control.
Yes.
And that could be, emotionally. So you feel like you're not able to manage a situation. So let me just bring it. All of us go through anxiety,
So
and it's not necessarily a bad thing.
Obi,
it's not necessarily a bad thing.
Kuogopa yani, ama utasemaje Kiswahili? Lugha mtaani.
It's a bit more than kuogopa. Yes, it has a bit of kuogopa, that fear, but it's a bit more because kuogopa, you might be fearful of just one situation, and it goes, for example, the anxiety that we have around exams. In this part of the world, exams are really huge, so there is some anxiety that comes with the exams, or even job interview.
Yes.
But then, that is situational. But then when we talk about anxiety around maybe a pandemic like COVID, this continues for long until it begins to now have detrimental effects on your physical health, so perhaps your heart can't stop racing, and that eventually will have an effect on your heart ability to function normally. And sometimes this anxiety, if it continues for long, it will begin to have physical ailments attached to it, like stroke, if it goes on for long, if it's not mitigated.
So how do you control it? Or what? And listen, excuse my ignorance, really, because as you said, some people. No, look. You see, when I was growing up, something like mental health was never discussed, really. You were told to soldier up. You carry on. You don't show fear. And you mentioned about your heart being racing. You are out of control. So for the young person that's looking for opportunity and they have this kind of feelings, and I don't want just consider about anxiety. I know there are other symptoms of mental health challenges, but just addressing anxiety, how do you work around that, Obi?
Very important, very important. I think, first of all, it's important to acknowledge. Yeah. And like you said, we live in a society where we are told to just man up. And for many of us, we know that just doesn't hold water. So it's important to accept and acknowledge that you are anxious. Perhaps it's even important to identify, the situation that brings that anxiety. And I would mention, for example, if you have somebody you can talk to about that anxiety, what this does, once you acknowledge that you are anxious, then your whole physiology changes, unlike when you resist it. Nowadays we have this term, rather than suppress, process. So rather than suppress something like anxiety, acknowledge it and even see how you can process it. And one way of processing is really talking to someone. And I think with this time of COVID, one of the challenges that people have had is isolation. Many of us, either because of the fear of the pandemic, we've isolated. We are working from home. Many people fear going out sometimes for whatever reason, whether fear of being infected with the virus. But isolation, when you are anxious and then you isolate yourself, partly is you just listen to your own voice. And, it's not always good to listen to your own voice. Actually, they say that, when you shut your mouth, then you listen to other people. But when you talk to yourself, you are only just listening to your voice. And anxiety actually becomes like racing thoughts. You just begin listening to, maybe I'm not going to do well in this interview. If it's an interview, I'm not going to even get a job. And that becomes that voice that plays over and over. And it can be debilitating, if I may say that.
So you said self-prophecy, isn't it?
It can actually become like the slippery slope or a vicious cycle that might actually end to be a self-fulfilling prophecy.
Yeah. Do you know, I've never heard of that term in terms of when you listen to yourself, you listen to that that negative voice, that little voice, isn't it? You're like, you cannot do it. Wow. So when you talk about, when you feel that kind of feeling, you go talk to somebody else. So does this mean a family member, friend, or even a professional?
It depends. Usually, the first point of contact for many people is someone they trust. It doesn't even have to be family. It's good if it's family member, and actually part of the the training we give, mental health trainings in the communities. We encourage caregivers to be people who are good at listening and not judgmental. Yes. So it's good if it's a family member, maybe your mom or your dad. Usually the challenge with that is most of those family members also kind of have some stake in it, so they will perhaps not be able to listen to you well. So it doesn't have to be family member. It's great if it's a family member, but if it can be a friend, someone who you've identified who's very understanding. And this is something that this has been kind of the trumpet call for mental health practitioners. Right now as we talk to you, many of your audiences are in Kenya, and now we have this issue of a DJ Lithium, God rest his soul in peace, who committed suicide. And one of the things we, when we have any incidences like this, we encourage people to come out and talk. It doesn't have to be a mental health professional like myself. I mean, because we are not so many, and I'm sure many of your viewers might not even know perhaps a psychologist somewhere.
Yes.
But it just has to be someone who you trust, somebody who you can listen to, someone who will allow you to express how you feel. And that's the first point, actually. And some people might not even need to talk to Obi, the psychologist. They might just talk to a friend who listen to them, because those thoughts are irrational most of the time. So you just need a sounding board, somebody who'll listen to you and maybe even probe a bit more. So you're calling yourself a failure because you didn't get this interview? I mean, come on, look where you are. Are you really someone who can interrogate those irrational thoughts?
Wow. It'll be interesting. For those that have just joined us, this is International University School of Soft Skills, and I'm talking to George Obiero, based in Nairobi, Kenya, works for UNHCR. But Obi is here as a capacity of Obi, not for UNHCR. It's good to clarify that. Now,
thank you.
Obi, what do you say? So some people usually say that, listen to your own voice, don't listen to other people, you just believe in yourself. So put that into context, because you're saying sometimes that inner voice can be communicating negative information to you. At the same time, people are saying, listen to yourself, don't listen to other people. Qualify that to us.
Yeah, it's a cliche, and I think to a certain extent it's okay. You can listen to yourself, you can listen to that deep inner voice, but it gets to a point where it's irrational. And when someone is anxious, and that's why I said the first thing is actually acknowledge that you're anxious. When you are anxious, most of the time that inner voice will be irrational.
When you say anxious, that's that butterfly feeling in your stomach. Is that part of it?
It could be part of it, but it's a bit more than just the butterfly. I mean, the butterfly, you could have it just because you've not, maybe for a young person on this listening to us, you know, they've not completed their term paper, they've not submitted a paper. That butterfly, that's a bit situational. But I'm talking about, you know, like anxiety that might manifest to a mental health condition. The moment when you become anxious, many times you will be irrational, you know, and so that little voice might not be very rational, and that's why it's important to have somebody who can listen to you. And many times people come to me as a psychologist. I'm trained to listen and not really advise, and this is what I would encourage many of your listeners who are on this show. You know, when somebody comes to you, don't be quick to offer solutions. Actually, many people say the solutions somebody tell you, in fact, you won't even follow them. But the solutions that come from you, where maybe somebody listens to you and allows you to hear yourself, how irrational you are. Now you verbalize it, and they're hearing you. And many times people come to me, and I don't even tell them something, but they tell me, okay, now that you're saying this, actually, I hear myself sounding very rational. So they confirm for themselves just by being there and listening and asking the right questions, not advising.
Wow, I like that, Obi. Interesting. So one of the soft skills that employers are looking for is ability to listen. So I'm going to ask you this. So how do you tell one's a good listener? Or if you go to an interview, how do you tell your employer or the prospective employer that you're a good listener?
Wow, listening is one of those things that I can't train people enough. We live in a society where people don't listen, you know. Yes. I mean, you've been in situations where you go and you're excited to tell somebody.
Oh, we're losing Obi. Obi, come back. This is a live show. Sometimes we cannot control this. For those that are joining us, this is University School of Soft Skills. And I was talking to George Obiero, based in Nairobi, Kenya.
But everyone has their ears open.
Obi, we lost you. Good, you're back. Can you hear me?
Yes, I can hear you. Sorry, Kevin.
Obi, so bundles anyway. Look, let's go back again. So you are talking about like we're living now in a world where people don't listen. We just don't talk. So please carry on from there.
Yes, people don't listen, you know. You have someone talking and the TV is on and they're on their phone. Listening is a gift, Kevin. If you go to someone who is able to listen to you well, you feel, you know, like somebody has honored you with their time to listen. I mean, I challenge my colleagues who we work with, and I tell them, for me, if you come to my office, of course, this is part of my training as a counselor. If you come to my office, I have one part where I have my workstation where my desk is and the computer is. But when you come to me to my office to tell me something, I will literally turn from my computer and look at you and just be there and not concentrate on my computer. Many times you go to offices, someone is listening to you and they're typing on their keyboard. You feel that you're not, you know, you don't feel like they listen to you. And I think listening is something that we could all really make this world a better place if we were able to listen to one another.
Obi, you're very good, man. You're very good, Obi. You're very good. Now, let's talk about listening still. So, how to train people to listen, then, Obi? And as I say, you know, this is something that employers are looking for. Because sometimes, I say, when you're very excited, you tend to want to speak and speak. And also, some people assume that when you speak too much, that means you're an expert or you know what you're doing. But sometimes that's a coping mechanism of fighting your fears, what I mean. So how do you train? How do you tell somebody that this is some of the steps to be a good listener? Because they don't teach this in school. In school, they don't teach us how to listen.
Apart from counseling training, psychology training, we are taught to listen.
Of course, well, listen, I'm not a counselor, I'm not. But
yes, I understand that. I understand that.
But you see what I mean? I mean, we don't listen, do we?
Yeah, I think it has to start from the very basic, you know. Good listeners don't listen as they think of what to say next. That's what happened to us. Kevin tells me something. Before he finishes, I'm already preparing an answer. I'm not listening to Kevin. When I'm preparing an answer, I've logged out because I'm preparing what I'll tell Kevin. So in counseling training, for example, we are told, just listen. Don't prepare what you're going to say. And you don't even have to say anything. Many of us, we have this compulsion to say something when somebody tells me something. And I think that is where we lose it. Yeah, we just need to listen without preparing a response. That denies me the opportunity to be with you as I listen to you. As I told you, many people come to me and I don't tell them anything, but they leave there saying, thank you. I feel heard, and now I have clarity. Many people come to you when they just want to hear themselves, and then, they already know what they want to do. They just want to hear somebody being there and listen to them.
Obi, someone just sent me a text here, and I read to you. Where did this young man get all this knowledge from? How do you answer that?
Well, first of all, I'm flattered they call me young. Kevin, we are not young.
No. Obi, you are young. I won't say how old you are, but you are. But I think the appearance as well. And I think people relate with you. What you are saying, the way you look, the way you are saying things. So just out of curiosity, what's your training, Obi? I know we went to college together, but then what happened?
Well, thank you for that complimentary, very complimentary comment. I've really been fortunate to work in the humanitarian field. So you mentioned that I work with UNHCR. I'm not here officially to represent UNHCR, but yes, I've worked. I've got opportunity to work in many countries, in 3 continents. Africa, the UK, that's Europe, as well as North America. Of course, my training also in psychology and has really also equipped me with skills. And of course, life. I've also had the opportunity to be mentored by people I look up to professionally, and so I mean that maybe sums it up. I don't know if it's sufficient, but yeah, life has provided me opportunities to learn.
Wow, that's interesting. And someone was saying that they can be so fast. I'm missing them sometimes. So someone is saying it is good to see a face like that in the UNHCR or in the UN field. I suppose he's trying to say that these kind of organizations, people assume that someone like you don't work there, or if you were working there, you may be working as a junior officer, for instance. But clearly, just the way your appearance, you inspire people, and that's great hobby, I think.
Thank you, and I believe it always helps to see. It always helps to see maybe someone like yourself, and I would encourage many of your viewers that these jobs are, for people like us. We don't have to feel inferior. I know you and I growing up in the slums, there is a bit of inferiority. And I think that is part of what we also want to encourage people to be able to come out and get help if they need to, but also be bold enough to look for opportunities in organizations like the UN. Look at what opportunities are there, maybe for a young person coming up. So yes, thank you for that comment, and I hope I inspire someone. Thank you.
Yeah, and whoever's listening to us, as you say, these jobs are for us. So you go for it. Now, again, for those that have just joined us, this is International Varsity School of Soft Skills. My name is Kevin Anyango. I'm speaking to George, based in Nairobi, Kenya. Obi, depression. You hear everyone talks about depression, people taking their lives. Like, for example, you mentioned about the Capital DJ. Depression does not attack or does not just affect poor people. When I say poor people, people without opportunities. Depression can happen to anyone, isn't it?
Yeah, I mean, I want to. That's a good question, and I think it's important to just create a bit of awareness. Depression, just like cholera or headache, depression is a disease. It's a disease of it's a mental health disease, but it's a disease like hepatitis B or diabetes, that can affect anyone. It doesn't matter your socio-economic status. Yeah.
Right. So, for example, you hear someone saying, I'm depressed because maybe I don't have a job, or I'm depressed because I lost opportunity. Now, you put this into context, like it's a disease that can be cured. So how do people go around this hobby?
Yes, given the 2 years that this pandemic has been going on, we have seen an increase in the reported cases of mental health conditions, depression being one of them, of course, anxiety, and there are many, personality disorders. There has been an uptick in the number of reported cases. It doesn't necessarily mean that there are more cases than there were before. It's just that the reporting has captured. Yeah. So you've zeroed in specifically on depression, and I want to mention that depression is treatable. And it is important for, again, if anyone on this platform, has a sense that they're going through a depressive episode, that they get help. However, I want to also, mention that there's a depression which is a clinical condition that needs to be diagnosed, and then there's the word depression that we use, on a day-to-day basis. I'm depressed. I just woke up. It's a Friday, for example. For me, a Friday, I kind of I'm slow-paced. I don't normally. Monday to Thursday, I tend to wake up energized at around 5. I freshen up, go check my emails. On Friday, somehow my body just doesn't click as the same. So I feel a bit jaded energy-wise. And sometimes I would say, I'm kind of depressed. That's not what we talk about when you're talking about a clinical depression, where you need to be diagnosed. And for depression specifically, this has to be a feeling that has been going on for, there's even a period of time. It's not just something that happens once, one morning. So there is the clinical diagnosis called depression that has even, this is how you can diagnose depression. And then there's a day-to-day talk of, I'm depressed, maybe a situational kind of I'm going through a situation and I say I'm depressed. It's different.
So being in a bad mood doesn't mean that you're depressed.
Not really. And many of us, you and I included, we will have a bad mood. I do have my moments. And I think it's within, having a bad mood is within the range of human experience. The range of human experience. One day I get excited, like I've won a lottery. Another time, I lose something and I'm just down. I mean, that is normal within the spectrum of human experience. But then we have now the clinical depression, where someone struggles to get out of bed, where someone maybe is not able to even wake up and brush their teeth. They begin to neglect themselves. They begin to have those thoughts going on for perhaps even more than a month. Now there we begin to wonder, is this a clinical depression episode?
So you cannot self-diagnose that you're depressed. You've got to be.
Of course not. No, it is a mental health diagnosis that you need to present yourself to a psychiatrist. In many countries, even a psychologist cannot diagnose depression. Yeah, even in Kenya, a psychologist cannot. You need to present to a psychiatrist, and then the psychiatrist will, they have screening tools. And then, of course, they go through the whole process of assessing and diagnosing the disorder.
So you've got to be diagnosed.
You've got to be diagnosed, but that doesn't mean that if someone is feeling, having those feelings, that you cannot intervene. One of the things that we also encourage is early intervention. Kevin, early intervention is important. You don't have to wait. Someone is not getting up from waking up from bed, Monday to Friday. Someone maybe used to meet and hang out as young people, and they don't show up. And then you say, no, we are not intervening until you go and get an official diagnosis. No, we are talking about early intervention. If someone who's for example, there are 5. Allow me just to highlight, please, 5 risk. Okay, 5. Let me call them 5 things to look out for in terms of deteriorating mental health. That can manifest depression, can manifest anxiety. 1, sleep and eating pattern. Change in sleep and change in eating pattern. Either sleeping too much or not sleeping at all, or eating too much or not eating at all. That is 1. Number 2 is unstable mood, so frequent mood swings, outbursts of irritability that prolong. That's number two. Number three, disconnecting from everything and everyone. Now, this is where you talk about isolation, and disconnecting from maybe even the things that you used to enjoy. So for you, if we go for 6 months, we don't see you doing Mtandao, we might wonder, Kevin was so passionate about Mtandao, what's happening? So you leave the things that used to really energize you, you don't contact people, isolation. That's number three. Number four, feeling of being down all the time, feeling of just being down. You no energy. That's number four. And then finally, difficulty concentrating, memory loss, you can't recall information, that even the things you used to know, you can't. Those 5 things, if you see someone going through those 5 things, you need to begin to see how early can we intervene, because those are telltale signs of deteriorating mental health.
Wow, Obi, I'm glad you mentioned that. And I'm going to ask you this now. Seeing a psychologist or psychiatrist can be very expensive, isn't it? And you're saying that for you to say actually you're depressed, it needs to be diagnosed by profession. So, for example, in Kenya now, where would people go? Just a normal hospital? Is there anywhere you can refer people to?
Yes, that's a good question, Kevin. And many of us in this field, we are really pushing for mental health. For example, in Kenya, you've given a very good example of Kenya. And right now, for example, with the unfortunate passing on of DJ Lithium, there's a lot of talk about, suicide prevention. In many countries, for example, in the UK, an article like that one talking about DJ Lithium's unfortunate death, at the bottom there would be, if you're feeling these and these feelings, please contact the National Suicide Prevention Helpline. In Kenya, we don't have something like that. So we are really pushing to have mental health mainstreamed, in the national health strategy, where we have psychiatrists. They don't have to be like psychiatrists, but we have people who've been trained even at the level of level 1 hospitals, where you go when you just had a bad stomach and you're wondering, you've tried taking tumbo seed and whichever other, and it's not doing anything. When you show up there, you remember those days of tumbo seed?
Yes.
When you show up there, somebody can be also beginning to assess if it could be a mental health condition. So we are really pushing to have that mainstreamed, even up to the level of the national clinic, that you go to. But for now, of course, it's still wanting. But also, I want to say, you don't have to. I don't know if the diagnosis really gives you anything. If I know somebody, those 5 signs of indicators for deteriorating mental health conditions. I don't have to wait until somebody, if I see my friend has that, I don't have to wait until they go and get an official diagnosis of depression. I can intervene. And that's why I was saying early intervention is so important. When you're talking about young people, if we don't intervene even from high school, when we see young people beginning to behave in certain ways, then we don't intervene, then eventually it becomes a full-blown mental health condition.
Wow, Obi, what's the role of employers when it comes to helping employees with mental health challenges?
Well, you cannot discriminate. Like any other condition, even HIV and AIDS, right now in our workplaces, even if a staff is HIV positive, you cannot discriminate against them. Actually, you are supposed to, have perhaps an insurance where they can continue to get their ARVs. So the role of an employer is actually the provision of help for employees, and that does not exclude mental health. The only challenge, of course, is mental health. With mental health, there's stigma. So somebody can come to the employer and say, I was not able to come to work yesterday because I had malaria. But many people will not come and say, I could not come to work yesterday because I had an episode of anxiety. So in the workplace, there's also important to create awareness that it's okay to come out, particularly now with COVID. It's okay to come out and say, because of working from home, I feel isolated, I feel stressed, I feel anxious, and I need help.
But Obi, there are those managers that when they see you struggling, they tend to go home and get checked.
Yes, I mean, I think it should be also handled very confidentially. And this is where a lot of education is important. I mean, we're really talking about, educating the society about mental health, educating the society about, reducing stigma. So a manager, before they tell you go and get checked, I think it would be important. And it's important for every manager to at least create an opportunity for you to open up to them. And even ask, you can't really command me to go and get help, go and checked. It has to be a way where it looks supportive.
Right.
Right. We will have people in workplaces who have mental health conditions. It's not unique. It's not something even to be frowned upon. We will have people who have depression. We'll have people who have anxiety. We'll have people who have PTSD. What is required from a manager is to show understanding and care. If my manager calls me and say, "You George, you look like you're anxious, go to the hospital," I won't go. And already that is a stigma for me. But if the manager comes to me and tells me, "George, I noticed lately, you have been, I give you projects, maybe you don't look excited as you are. Would you need someone to talk to? I mean, would you need any help from me?" That's different.
Obi, we cannot have the discussion without talking about the role of internet and social media when it comes to mental health challenges. I don't know what to ask there. Come on, what do you think? And for example,
well, two things. Like with anything, the internet has actually really. I mean, look at what we are doing now. This is information that hopefully is helping someone out there. So and it's because of the internet that we have this platform. And then of course the explosion of information that has come with the internet. So in many ways, internet has really helped. But also, as you'd imagine, and I think many people are quick to point this than to talk about the information that is now readily available on your fingertip just by getting into Google and all. The flip side, of course, is before I used to compare myself with my neighbor in Gomongo. I grew up in Gomongo. So in terms of self-image, self-esteem, I would just compare myself with my neighbor in Gomongo. Now, because of internet, I compare myself even with somebody in Atlanta, Georgia. A 16-year-old I feel like I want to compare myself with the 16-year-old in Atlanta, Georgia, who has numerous opportunities that maybe I don't have. Whose life is totally different. And so because of that, that has really. If you spend too much time on the internet, inevitably, you begin to feel down about your situation. You begin to feel like the world is going on everywhere, very well for everybody else apart from you.
Yes.
But apart from that, also, there's the other aspect of bullying on the internet. In psychology, we have something called online disinhibition. When I'm hiding behind my keyboard, I can type anything. But if I meet you face to face and you ask me, "Hey, Obi, there's some things you typed, tell me face to face," I will not be able to. And I think we've seen many people being really bullied and people becoming very nasty, and someone like yourself, this better than anybody else, perhaps. You've opened up this platform for many young people. I'm sure even on this thread now, there will be people who will say, "This guy, blah, 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 blah." And for a young person, they take that to heart. Maybe they have not developed so well to be able to realize it was only one bad comment. After all, there were 99 good comments. But for young people, many who are still very easily impressionable, they find themselves really taking that in and then beginning to really grapple with their own self-esteem. So the internet is what, it's important to have a way where you engage with the internet that, it's not too much of what you do, but also, you can use it for the benefits that it has.
So should we talk about this in school? I mean, for example, from young age, I know you've got kids, I've got kids. Those, let's say, from like age 5, should they talk about internet trolls in school, or is that role of the family?
Oh my goodness, not school. It should start from home. Now we have parents who give the children internet as toys. They give the children a phone. They give the children their phone, and the child starts, going into Baby Shark.
Yes.
Because the parent wants their peace. They've come from work, they're tired, and the child is like asking them, daddy, blah 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 blah, and the parent is tired, so they just dump the phone on the baby, and so the baby begins to get exposed. 3-year-old, 4-year-olds. I have friends who 3 years old, they give their children their phone. My son, my daughter, I have an 8-year-old, I have a 5-year-old. I don't give them my phone. I can't give them my phone. So if you're talking about cyberbullying, you should start at 3-year-old. If you're giving your child a phone at 3, when they're 3, talk to them. Don't wait for the school. By the time they're going to the school, it might be too late.
Wow, it's good to know that. So, Obi, how do we ensure that our mental health position or our mental challenges are in check? For example, activities. The pandemic, for example, in Europe here, they closed cinemas. They've only opened stadium the other day. So there's nowhere to go. People are just staying in their houses. But outside the pandemic still, when I'm looking for work wherever and I don't find these opportunities, I start having the symptoms that you mentioned. What are some of the things that we can do to make sure that we remain sober? And even if we get attacked or get, let's say we get sick from mental health challenges, how do you control it? How do we fight it? How do we make sure that we're okay?
Again, this is actually just to segue on just what you're saying. The role, it starts in the family, Kevin. It starts in the family, yeah? Having a good support system within the family unit is so important. Like they say, charity begins at home, So it has to begin. And I know for some of our viewers, maybe this is not necessarily within their forte because, they're young people, they don't have families. But now that you've asked me about just, how to enhance mental well-being,
yes,
it has to start in the family. How children are raised. A child who's raised using a phone begins to be exposed to a world that is not ready for. He's not ready for a world where people can write very nasty things about you on the internet. So it has to start at home, and then it has to start within the community. And for you and I, Kevin, we are fortunate that we perhaps got opportunities within our communities to begin to develop ourselves, to begin to build our self-esteem. I remember one of the things that drew me to you was when we were in campus was that we all had a background of volunteering, yeah.
Yes.
And I want to go so much into volunteering because I know for you it had it even led to you met your spouse.
Be careful.
I'll be careful. So I want to go into the details, but getting opportunities. So let me just talk about what is mental health. Mental health is a state of well-being in which an individual, and this is a WHO definition that was actually coined in 1948. So mental health is a state of well-being in which an individual, one, realizes his or her own abilities. And when you're talking about abilities, we're talking about, you realize, how you deal with things, feelings, emotions, mental faculties. So that's one. Number two, can cope with the day-to-day stresses of life. Life as it is, inevitably, one day you'll face a challenge here or there. So a mentally healthy person will know how to cope with the day-to-day stresses of life. Number three, so number one is realizes his own or her own abilities. Number two, can cope with the normal stresses of life. Number three, can work productively and fruitfully. And then number four, can make a contribution to his or her community. So if you think about how to, even the young people who are listening to us right now, if they want to enhance their mental well-being, is also to look for opportunities where they can make a contribution. You remember in the olden African system, where we had cohorts of young people who were being, kind of going through initiation from childhood to adulthood. They were given roles. Some of them, for example, the Maasais, as from 16, maybe around there, where they're being initiated into adulthood, they would be the ones protecting the community. That's a role. You see you have a role and you're making a positive contribution. That contributes to building your own mental well-being. So we need to look for opportunities even within this community. For me, it was football. I really enjoyed playing football, and that helped me feel that, it helped my identity at that time, and because of that, I started becoming confident in who I am. I wasn't this eloquent. I wasn't even very good in English, but through something that I felt, I was able to do well, and my peers actually appraised me that I'm good at it. Then it gave me skills and for the next challenge, which was perhaps now navigating workplace.
Wow. So you talk about sports here, Obi. So don't just stay at home. Feel like you're being useful.
Do something. First of all, you appraise yourself with your peers. So, those are the times when I remember, like in primary school, we had first body, second body, and everybody knew their place in the pecking order, So you appraise yourself based on, if you're a boy, if you're a boy, there's first body, second body. And when you're first body, everybody knows, and nobody plays with the first body, No. But for you to be first body, you had to fight, So you appraise yourself amongst your peers. And then, of course, there's the appraisal that comes from your parents, And then later on, you begin to appraise yourself now in the society. And one way of appraising yourself is being with your peers. You can't really be isolating yourself. In fact, one way of not having a good appraisal of yourself is when you isolate. So when you are involved in activities with other people, for example, sport, for example, a local community initiative of collecting garbage, you work with people, and through that you begin to develop some competencies.
And that's a very good, and I think that's a very good way of ending this show, Obi, talking about looking after your own well-being. And one of the things I was going to ask you is, how do you show an employer that you're actively looking after yourself well? And you talked about sports, taking part in the community, and even the role of the church as well, isn't it?
The role of the church, you have to be, and I've been fortunate to be in several interviewing panels, and I think what I look for someone all round, you don't become a manager in the workplace. You become a manager in the community. You rally people together. You come up with an idea, you sell it to people buy it, and you start, assigning roles. And if you think about some of those things, you either learn them as a young person doing a sporting activity. You either learn them in community, engagements, with your peers in the community. In the slums, we have groups where young people, realize that garbage can be a business, so they get into collection of garbage and they get paid. So as a manager, I'm looking for someone who's not just good at what I'm asking them to do, but do they have any skills of rallying people? Because eventually, 5 years down the road, I'll be looking for a manager.
Well, Obi, listen, I can speak with you all day. And the stuff you're saying here, I wish I had this like 5 years ago. But they don't say this is cool, Obi. For example, talking about like belonging. You feel like you want to belong somewhere. You talk about the master's culture, for instance, you feel like being fruitful. But sometimes, let me talk about the politics in college, for instance. There are some teachers or administrators that look at active politics as being a rebel. But they should be encouraging people, isn't it? You and I went to the same college, and there are some things that you could not tell a vice chancellor in a respectful way, because they are saying that as a young person, you cannot just, you cannot stand in front of somebody, an older person, senior than you, and tell them what you think, peace of your mind. So the culture has to change a bit, Toby.
The culture has to change, and it is changing. It is changing. I mean, with the internet and all this, the culture is changing, whether we like it or not. Even the workplace is changing, and some of this change, it's going everywhere. If you think about Uber, for example, before you couldn't get a taxi to go to town. The prices were just, what you'd be charged would be an arm and a leg. Now you just go on your app, you go on your phone app,
Yes.
get an Uber or Bolt or whichever. I'm not advertising for anybody here, but yeah, it's
No,
so easy.
They have not paid yet, so you cannot advertise it.
You know, and I remember when this these apps for taxis came in, there was a lot of fighting from
Yes.
those cartels that were running. But finally, Kenya was ranked, Nairobi was ranked as one of the best places for expats in Africa because of even easier connectivity.
Yes.
Expats, some who are my colleagues, they love Nairobi because they say, I don't need to even own a car in Nairobi. I can just Uber, I can do Taxify, I can whichever, yeah. So that shows that change cannot be stopped. When it's time has come, you cannot stop. And right now, young people are getting more opportunities to express themselves. So if you're a university's chancellor, a dean of students, my friend, you have to create opportunity for young people to express themselves. And now, because you've talked about leadership, in this country, many of our leaders, and we were discussing this with my wife the other day. My wife went to KU, we went to Daystar together. Many of the leaders that are coming up, in the national politics were actually leaders who cut their teeth at campus. And I can mention several, even just from the top of my head, who went to school with my wife. Yes. So we have to give opportunity for young people to rally and do things together. Of course, they have to be constructive and they have to be guided in some way. But that is where you cut your teeth. You can't just come out of nowhere and run for a political position, maybe an MP. Many of these young people started really getting appraisal from their peers and electing them in those university positions before they even got a sense that they have the ability to mobilize and actually lead people.
Oh, Obi, that's the best place to end now. You're talking about people just appear from nowhere. When Barack Obama was running for presidency, many people had this notion that he was naive, he didn't have experience, but people forget he was a community mobilizer. So he didn't just come from nowhere.
He was a community mobilizer.
So
he was a community mobilizer.
So nothing just happened like that. Like, you see someone today and think, this guy, where's he come from? There is a history of people building themselves up, isn't it? Obi, the role of mentorship, is that overrated? Is it important when it comes to fighting?
My goodness. Allow me to kind of, I did mention myself that I got mentored. The role of mentorship cannot be overemphasized. It is so important. Unfortunately, many of us, we start where, like you and I started, and then we get these good jobs and we forget. And so in this regard, you really inspire me. I mean, this is 20 months. This is 20 months since you started this. I mean, you hosted me among the first people on the show, May of 2020. You're still doing this. I'm inspired by this. People coming back and giving back and taking young people and mentoring them. I was for those who know me, I'm very passionate about mentorship. Unfortunately, for the last 5 years, I was always out of the country. I worked in South Sudan, I worked in Nigeria, but for me, I'm always available to mentor young people. I get a lot of, energy from mentoring young people because I was mentored. And so young people look for people who can mentor you and avail yourself to be mentored, because I mean, mentorship is both ways. I could be available, but you don't want to be mentored. So the role of mentorship is so important. And for your audiences, I could talk the whole day about mentorship.
Obi, I can't thank you enough for your time. And it's always a pleasure being a friend. And I know we talk very often. And I suppose for those that listen to us, don't just stay at home if you feel like you're going through a depression mood. And also, it's worth mentioning here, Obi, that we've got to be diagnosed. Don't just talk about depression just for the sake of it. It's a serious matter. It's not just about having a headache.
Yeah. The thing with that diagnosis is then you're able to, whoever it is, able to take the diagnosis serious, and of course they don't just diagnose and then tell you go away. They will have a treatment plan. Perhaps even after diagnosis they'll give you some prescription medication that you can get to help manage the mood, because depression for most people, it manifests as just heaviness of getting out of bed, feeling down, and at that point someone might need some medication, some drugs to help elevate their mood, and then they can now begin to talk about what is really making them depressed. So diagnosis is important, but let's not just wait for diagnosis, because like you said, in Kenya, psychiatrists are not so easy to even get appointments with. Let's intervene even earlier enough. Not everybody needs to get to a psychiatrist. If we intervene early, they might not even get to the full-blown depressive mood.
That's correct. Obi, thank you very much for your time. And for those who just joined us, this is Mtandao University School of Soft Skills. I was talking to George Obiero, based in Nairobi, Kenya. Obi works for UNHCR, but he was talking to me as a capacity of Obi, not for United Nations. Obi, thank you very much for your time, and I'll see you soon, mate.
It's been my pleasure, Kevin, and thank you again for this opportunity. Thank you for what you're doing. Mtandao University is great, and please have me again back on your show, and keep doing it. Thank you.
Obi, tuma kitu sasa.
Okay. Nitume kitu. Okay.